there are many benefits for community outreach programs for healthcare organizations. The main one, the community outreach, increases the opportunity for partnerships within an organization and to extend the healthcare organization's footprint and be able to get their mission out. The relevance of the programs typically to kind of get the word out for some of the area healthcare needs, such as mammography screenings, diabetes, high blood pressure, rectal cancers, etc. Kind of get the word out to the community to see what the most common disease paths are, so the healthcare community can aid with the screening and management of these disease processes. Some organizations, such as nonprofit organizations, are required to have community outreach programs or to give back to the community benefit. So these types of programs will help aid for our nonprofit organizations to maintain and keep their nonprofit status. One community outreach that I feel would be important to address would be breast cancer. Breast cancer in the United States in 2022 will be an estimated of 287,850 new cases of invasive breast cancer are expected to be diagnosed in the United States, with 51,400 new cases of non-invasive in the United States. That basically is about 1 in 8 women in the United States who develop invasive breast cancer over the course of their lifetime. So I feel that getting the word out for early detection, screening, mammography, breast ultrasound, breast MRIs should be high on our community outreach, being that our community is at over 50% female, and out of those population statistics, the vast majority of those women are over the age of 40, which would be the first year that someone should be receiving their first mammogram with no prior breast problems. If someone has a strong history of breast cancer within their family, they should have their first annual screening done at the age of 30, with it being done every 2 years after that, and then yearly at the age of 40 and on. This is without symptoms, of course. For women in the United States, breast cancer death rates are higher than those of any other cancer besides lung cancer. So I do feel we should do some community outreach for the local women in regards to breast cancer and breast awareness. Our second community outreach program will be more geared towards the student athlete. I also was a student athlete locally within my community, and one year they did some of the local physicians got together and did the annual sports physicals at no charge to any of the high school students. I have not seen that program since I was in school, which was over 20 years ago. And I feel that this would be a great opportunity for our local hospital to give back to the community and do this at minimum 2 times a year to promote the fall and spring sports, to be able to administer those sports physicals at no charge to our local student athletes, to make sure they're safe, healthy, and ready to compete. We can also offer exams and follow-up appointments for any students that may be having any kind of concerns or health issues. Relay that information to the parents and get the grade set up in our local clinics for follow-up appointments. I feel that these 2 programs would benefit the community and appeal to the community because they are near and dear to the hearts. First and foremost, when mom is happy, everyone's happy, right? So, but back to the breast cancer early detection programs, screening programs, and just getting the overall information out for breast cancer and the type of exams and screening exams and the increments that they need to be prescribed at. Being that most women fear mammograms, they don't like them, they're uncomfortable, and so they typically try to avoid them as long as they need to, or as long as they can, I should say. But we need to get it out there that early detection is key, especially in today's world where 3D mammography is fast, it's easy. The early detection is superior than the old days. Compressions are much more comfortable. They've developed paddles that are much more comfortable for the women. Now back to the student-athlete physicals program. The benefits and appeal to the community will be cost-effective physical exam for student-athletes, especially for those that maybe have the lower income and have a hard time getting them to providers due to financial reasons. Secondly, I think this will be appealing to the community because of the wait times with a lot of our physicians and pediatricians. We can kind of stage this at one night, get them in, get them out, and makes it easier for the parents to get the kids there versus during the workday when they may have to take time off of work, take the child out of school to go and get a 20-minute sports physical. Not only that, but this will show the support for our local community and our local high school student athletes. What is it that we're going to benefit from these community outreaches? Plain and simple, it's going to put our name for our local hospital out there to the community to show that we want to prevent any kind of bad illnesses, help them understand the necessities for their screening exams, as well as for the students with the sports physicals. Along with being able to introduce our physicians to our community via the sports physicals, or our breast specialists and mammographers to the community during our health fairs and our breast education program. That way our patients fully understand who they are seeing, can put a face with the name, kind of ask questions, be able to make the patients feel that much more comfortable. We will also gain additional appointments and or possibly capture patients from outside areas that were not known in our network, just to show that we are there for them, maybe able to coerce them to come over and visit. We will measure these goals throughout the year after these two outreach programs get kicked off. We will kind of look at our mammography numbers and ultrasound, breast ultrasound numbers, MRI numbers after the program has kicked off to see if we have increased any of our patient visits due to the fact that we are reaching out to the community, educating them. Hopefully at some of these seminars that we're going to put out in community outreaches, we will be scheduling appointments, explaining how to do self-breast exams, etc. And then as far as with the student-athlete physicals, for those students that may be having health concerns other than for sports, I will be able to schedule those appointments with a pediatrician and also be able to have some more sports medicine physicians on site doing these physicals. Therefore, if during the season they have any kind of sports-related injuries, we will be able to capture that business because we will have our physicians out in front of the parents. Therefore, the parents will have one-on-one relations with those physicians, just in case if their child does become injured during the season.